I want to talk to you today about pain on the outside of your knee, lateral knee pain when you're out on the trails, whether that's mountain biking or hiking, and you don't have the tools at home to actually treat and alleviate your symptoms. This happened to me last weekend when I was running and had to stop, treat myself, and it allowed me to keep going pain-free. So here are my 4 treatment tips and techniques that actually helped me run pain-free and finish my segment. So first thing is we're going to actually use your knuckles. All right, we're going to do a little cross friction massage on this area. Okay, so you can go on the side of that shin bone, top front of that shin bone. You can work up into the quad, IT band, even this outer back hamstring. This is often a culprit because this hamstring comes down and attaches to this fibula and yanks it up, and then you can get compression. Okay, so back and forth, side to side, up and down. Find those spots that need to be alleviated. The second thing we're going to go over is a joint mobilization. So I have, and you have, a joint right here. It's where your fibula, the outside ankle bone, comes all the way up and attaches to your shin bone up here. You want to find there's a little bony spot, go above it with your thumbs. You can press down. You can press diagonally forward. You can press diagonally backwards, straight backwards, straight forwards. You can do it while you're bending your knee. Okay, find the angle that feels tight. All right, because again, like I mentioned, this can get yanked up or compressed together because of the muscles around here. All right. So the third way that we are going to treat this is with a stretch. So we're going to go through a figure 4 stretch. You might be able to do this standing, no problem at all. Can go here. You can hold on to something, a tree or a rock or something. If you have a bench, you can sit on the bench, go into your figure 4, and you want to check different angles. Okay, so I can go straight forward. I can bring my shoulders over my knee. I can actually go away from my knee this way. Okay, and the last thing we're going to do is, this is if you're running, can be also if you're biking as well, but especially if you're running. When you land, you want your toes wide. You want to spread them as you land wide. Okay, what does this do? So for people who collapse in with their foot, what that can do is it can travels all the way up here, and you can get compression and jamming in that outside fibula joint. So there can be several things that go on with this area, but if you're working on the tissues, you're working on the joints, you're working on the hip flexibility where you can have tightness coming down and contributing to that, or even calf stretches to work on that. That should help open up this area so you can keep continuing your activity pain-free. Let me know if you have any questions.